Hi, welcome to Rajal Naik. Today I am going to discuss about what exactly HIPAA is all about and what are the HIPAA compliances followed by the directives of HIPAA, all that stuff. When you see whenever the healthcare environment itself is concerned, in order to protect the health information as well as the data and all that, so there is a process which is being involved in healthcare industries called HIPAA, which is the full form of HIPAA as follows, like Health Insurance Portability and Accountability Act. This act majorly drives us to provide us guidelines regarding the procedures, what is that you require to follow whenever if you want to manage the data of healthcare of the sensitive information of the individuals, all that. At the same time, the kind of systems what is to be managed, all that. In this video today, I'm going to discuss about what exactly HIPAA compliance is all about, followed by the directives, all that. When you understand HIPAA compliance in a high-level view, it is something where whatever the physical and as well as administrative and as well as technical information must be safeguarded. At the same time, which is also covers the entities and as well as business associates, which must uphold to protect the integrity of health protected information. In regard to this HIPAA compliance, there are different checklists which normally we require to follow. Under HIPAA compliance, as refers to the checklist itself is concerned, the first was technical protections, where we have to encrypt and authenticate EPHIs, all that. At the same time, we need to control and log access and changes EPHIs, all that. Followed by this auto log of facilities, all that. So technical protection is one thing which comes under HIPAA compliances. Followed by this physical protection, something like the kind of workstations what individuals are using to manage the healthcare data, all that. At the same time, how to protect and track EPHI devices, all that. Followed by this, how to control and monitor physical accesses. Along with that, when we talk about administrative protections, which will be majorly used to build and test contingencies, all that, and how these document security incidences and all everything should be maintained. Followed by this, in reference to the HIPAA, training staff, all that. At the same time, assessing and managing risk, all these comes under administrative protections. When we talk about HIPAA privacy rules to do, wherein respond to patient access request and all, updating forms and copies, training staff, get permissions to use EPHIs, all that stuff. At the same time, inform patients with NPHs and maintaining EPHI integrity, all that. Now, when you talk about HIPAA breach notifications and all, which promptly notify the patients. At the same time, it also ensures our notification contains the required elements. Along with that, HIPAA omnibus rules to do refreshes the BAA, followed by this training staff and update privacy policies, all that. So these are the different checklists one has to be followed when reference to the HIPAA compliance checklist itself is concerned. Now, when we talk about the requirements for HIPAA compliance and all, there are some performing self-audits is the one thing, which auditing performance, maintaining self-audits within the organization is the one kind of requirement has to be taken into an account. Next, documentation is the other requirement. At the same time, business associate management and how are we doing it. Followed by this incident management and how are we managing these incidents, all that. Along with that, having a remediation plan in place, followed by this developing and implementing policies and procedures, followed by employee training, all that. So all these are the requirements in reference to the HIPAA compliances, what exactly it follows. Now, when we talk about the rules of HIPAA itself is concerned, when we talk about that, there are some privacy rules where health information of an individual is must be highly protected. So for that, the kind of electronic transaction code sets and all everything rules will be maintained. Followed by this, there are different security rules and all everything were included in it. Now, when we're talking about the directives of HIPAA, when we talk about 5 main directives of HIPAA, the first one there are 5 different directives. The first one is Title 1, which focuses more on the forgotten insurance reforms that was introduced in the HIPAA by introducing rules about the accessibility, portability, renewability of the health insurance. When we talk about HIPAA Title 2, which concentrates more on the mandatory steps of the privacy rules followed by the security rules, at the same time, enforcement rules, all that. It also establishes the national standards of how electronic healthcare transactions are processed, as set out by the US Department for Healthcare Human Resources. When we talk about HIPAA Title 3, which majorly focusing on introduces new tax rules relating to healthcare treatment, including the provision of certain deductions for medical insurance. When we talk about the fourth one, which includes additional benefits on the reform of insurance law, with protections for those who have pre-existing conditions and individuals who wants to maintain their insurance. Now, when we talk about the Title 4, Title 5, which gives guidelines for the life insurance policies that are owned by the businesses, and how to have income tax specifies when someone has their US citizenship revoked. So these are the 5 major directives which are something relating to HIPAA part. So this is all about HIPAA compliance followed by the directives as well as the requirements in reference to the HIPAA compliance is all about. For more information regarding this, feel free to contact us, the providing details which will be posted in below to this video. Thank you.